back to the talk that drives America. This is Road Gang Radio. Let's rejoin Jimmy live from the Fastport Studios.
By the way, big thanks to Brad Bentley, who just shuffled off his radio coil for taking the first part of the ride. Brad, of course, is the president of Fastport, who's out there busily solving America's toughest recruiting and workforce challenges through research, technology, and people. From registered apprenticeships to veteran readiness, learn more at fastport.com or nationalapprenticeship.com. And speaking of sponsors, Truck Down, truck up, and get down. They serve 50 states and all 8 provinces. If you are a trucker or if you are a small company and you find yourself on the side of the road and looking to hook up with somebody who can get you the maintenance that matters, go to truckdown.com and they'll figure out where to send you next. Big thanks to all of them as well. This is the first segment of Highway to Health on Road Gang Radio. Dr. Franchesca Fiorito joins us this morning. I am so thrilled to welcome you because I have to tell you right now, and I almost am terrified to say it, from the time I was about 12 years old to the time I was in my late 30s, I was a chronic sufferer of genuine bona fide migraines. I don't know what I tweaked in my life, but they have become a very, very rare occurrence in my life. But it's good to have you. That is the topic of the day. There's lots to talk about. Welcome to the first edition of Highway to Health on Road Gang Radio. Good morning.
Good morning, and thank you for having me. I'm excited to be here, and I could imagine there are many people today that will hear this and really relate because it is a common and disabling disease.
And let me just say, because you're with the Association of Migraine Disorders, so you know of what you speak, what's really crucial here is to understand that there are people who and everybody who actually suffers from migraines, including my wife, who has done Botox shots, who has done 1,000,001 things. You've got an interesting solution we're going to talk about in a little bit here. It's important when people tell people, I think I got a migraine. I'm like, no, you don't have a migraine. If you think you got a migraine, you don't. You know what one is. There are certain symptoms. There are certain things that really kind of set it off. It varies from person to person, but can you, given that you're the expert here, really kind of define one for us so people understand? Because often the first time you get one, it is terrifying and very confusing.
Yeah, I think it's always important to know headache is a symptom. Migraine is a disease. Yeah. So migraine is a neurological disorder that's characterized by recurrent, intense headaches. So a person is predisposed to having these episodes, and it's usually a moderate to severe attack. It could be one-sided, although some people it's generalized. Usually they feel like they would rather lie down or reduce their physical activity. They could have light sensitivity, sound sensitivity, nausea, and even vomiting. So it's not just a headache. So it is important that when we talk about migraine, yes, we're going to have a bad headache, but we're going to have so much more. And I think that's what differentiates it from other, headache disorders.
One of the things, and like I said, they have become, I've made lifestyle changes, of course. They've become less recurrent, but when I get them, I get that, and somebody once called it an aura. I literally lose peripheral vision, and it becomes hard for me to focus in any direction, and it's the first telltale sign that the headache is coming. But there is I'll make this really clear, too, because you've mentioned a lot of symptoms. It manifests itself in different ways, but it is an extended kind of situation that goes beyond just, carrying stress in your shoulders and it's making your way into your head. This is not a standard headache. Where do they come from? I mean, are they passed down? I mean, there's a lot I don't know here, and so I'm thrilled to actually have you on.
Okay, yeah. So, it is a complex brain disorder. So basically, what is going on with migraine is there is a state of hyperexcitability in the brain, and different parts of our brain are kind of more sensitive and active. Why does this occur? There is a huge genetic component. So a lot of times it is passed down, like you just mentioned, and we carry it since we're born, and throughout life it starts to manifest. So that's usually what happens. A person that has a migraine was predisposed to have one. They didn't do anything, to cause it. There are triggers that make it worse, but you have to really be born with this disorder. So I hope that answers your question. And then because of this excessive brain activity and more sensitive brain where all these regions are being activated, we get, obviously the headache and all these other symptoms. We feel sick when we have a migraine attack. It's not only also the nausea, the vomiting. We can just feel kind of off, reduced energy levels, dizzy, neck pain, and have these reversible neurological symptoms, which you're talking about, like the aura. Aura occurs in around 30% of patients that live with migraine, and it is a subset of reversible neurological symptoms. Visual is the most common. We can get loss of, peripheral vision, a blind spot, zigzags, but there are other types of aura, like sensory and speech. So really, as we can see, this is a brain disease. So it is a serious thing in terms of it could be very disabling.
And the other thing is too. So full disclosure. I talked about having had it, and like I said, and I was kind of curious about this because, like I said, I used to get anywhere from 5 to 6 a year for the better part of 20 years. As I've gotten older, it has become less recurring. And like I said, I have made certain lifestyle choices, and I know that certain lifestyle choices, I didn't make them because of the migraines, but I have noticed that since I've changed some stuff in my life, are there strategies that people can use outside of medical intervention that can help reduce the occurrence and the recurrence of migraines?
Yes, definitely. I think that both options are important. So some patients do need pharmacological interventions, even though they do everything else right in life, and we can't live in a bubble, definitely, but there are things that can help us. So I always discuss with my patient that lifestyle changes do play a crucial role in managing and preventing migraine attacks, and that is something that they have in their hands to start with. Things that we can, work on are having a consistent routine, such as good sleep hygiene. Hydration is very important. It's underlooked many times. Eating regular meals, exercising regularly, as well as stress management. There are, relaxation techniques, things like biofeedback, meditation, mindfulness, deep breathing, yoga, and just general exercise. All of that is very, very important, as well as triggers. There is a group of triggers that we can identify are exacerbating our migraine attacks. Importantly, not everyone gets the same trigger, so it doesn't mean you have to avoid everything, but there are certain foods that we can identify trigger an attack, or skipping meals, the weather, loud noises, strong smells, stress, poor sleep, and in females, hormonal changes. So, identifying all these things can lead to an improvement in our, migraine disease.
Well, the other thing, too, and by the way, you've just kind of opened the door on this, too, a certain level of, even talking to somebody, a certain level of mindfulness really comes into play, because in order to understand, like I said, there is no one simple kind of equation that leads to migraine. Everybody becomes their own detective, but it's important to talk with people to figure out and to kind of do an accounting, sort of an inventory of, I'm beginning to figure out that this, and this noise, this smell, this moment are the things that tend to provoke these. And so, you must on some level, before we get to actual medical interventions, also encourage people to do sort of a mindful inventory of what puts them in situations where these trigger, correct?
Yes, correct. I think that it all starts with the individual person living with migraine. First of all, creating awareness that it's not normal to have recurrent headaches that are limiting our quality of life, and really, becoming more aware of what is exacerbating this so that they can start, maybe avoiding certain triggers and seeking medical advice. How can I make this better? We have to look at it as a sensitive brain. The person has less tolerance towards so many external triggers, and this exacerbates the condition. So I always encourage my patients, way before you should even start treatment, you should really identify what is exacerbating it, and work on your lifestyle modification, because if we can get you better in this matter, well, that's great. Why start you on a daily medication? Unfortunately, there is a group of patients that need treatment, and that is important as well.
I wanted to also, and by the way, I have been given permission to do this. My wife, who is the person who booked you, actually manifest are so severe that they manifest in stroke-like symptoms. Like the people who
Yeah.
don't know, or the first time you get around Claire, if it in fact happens, it can be a very scary thing, not just for her, not just for them, but for, in fact, the people around them as well. And so I kind of wanted to open the door on two things. One, how people who live with people who have debilitating migraines, how they can be a better partner. But also, I do, because I want you to talk about CGRP inhibitors, and I'll get to that in a second. But let's talk about living with people who have migraines and how we can best help them.
Yeah, I think it's extremely important to really have support from our surroundings when we live with migraine. Disclaimer, I also get migraine attacks, and I have been, for many years, I'm much better now, a chronic migraine patient, so I completely understand where you're coming from and your wife. Unfortunately, migraine is heavily stigmatized despite being so serious and disabling, as you're mentioning with your wife. You not only get the headache, you can get symptoms that can be scary. And definitely it's important to have a formal diagnosis to make sure those symptoms are part of that migraine disease. But this stigma leads to misunderstanding, underdiagnosis, and poor support for those who suffer from it. And this is because it's considered many times an invisible disease, right? Maybe if you have stroke-like symptoms, you're gonna, see the migraine attack. But a lot of times we're just internally living with the pain. And what does that what does that cause? The patient is going to feel guilt, shame, isolation, avoid activities, not want to talk about it, maybe not even seek care, feeling like, oh, I'm making this up or this isn't that serious. But if you support the person and show them, no, this is a true disease, I understand you, how can I help? How can I help make you feel better? What can we do to avoid this? It's going to really support them in their journey to acceptance and, getting treatment. So I think that it is very important to normalize that migraine is a disease. It could be disabling. Patients do not control when it happens on many occasions, and support and education is essential.
By the way, Dr. Franchesca Fiorito joins us this morning. I'm so pleased to have her on the show on the first highway to health here on Road Gang Radio. Guys, go to migrainedisorders.org to get a whole bunch of great information as well. If you have anybody in your life, or in fact you suffer from migraines, often getting the information. That's the other thing too. I will tell you this. The first time I ever got one, doctor, I was in a Little League baseball game in an incredibly stressful moment. I got the hit, I got to second base, and I suddenly realized that on the outside, on my peripherals, I couldn't see. And it set off a wave of panic. Of course, an 11-year-old boy, that's the other thing, too. They're not limited to adults, right? Younger people suffer from these, and often it can create a great deal of confusion and actually exacerbate and lead to rebound headaches and actually making the condition worse. Stress actually acerbates the situation, even in the midst of the migraine. Is that correct?
Yeah, that's correct. First of all, it can occur at any age. There are reports of 5-year-old children, even younger, that present with migraine attacks. And even, talking about more of the geriatric population, sometimes it is mentioned, oh, it goes away with age. Not with everyone. There is a peak in what we know as the reproductive age in females and productive age in all of us, where in adulthood, when we're working, having family, all of that, that's when it's more frequent, but it doesn't mean that it will not happen on the younger spectrum or the older spectrum. So I really say there's no limit to the age a migraine attack and migraine disease occurs. In terms of, stress and everything that's going on, really, these are all triggers that can make the disease worse. I do like to explain that if you don't have migraine disease, you are not predisposed, and you're exposed to stress, you will not get a migraine attack because you do not have the disease. So a lot of times when patients are told, oh, I have migraine because I have stress, or someone will judge someone, oh, they just have a lot of stress, that's why they have their migraine. I'm like, well, they have the disease, they were predisposed, and stress is triggering their attack. So yes, it can make it worse, but you have to have the condition to experience the migraine.
that's the other thing too, is that, that's one of the most awful things about it is sometimes you get the hit that saves the game. Sometimes you have a wonderful night where, you're given an award. There is no one simple kind of singular thing where, oh, that's it. Once we kind of master that, and at that point, medical interventions do become necessary. Can you kind of take us through them? Because I want to make sure we have enough time at the end to talk about shades for migraines in a second here. But can you talk to us through when medical intervention really becomes necessary and what forms it takes?
Yeah, of course. I think that, first of all, if we already feel like we have to avoid so many things to not have an exacerbation of this disease, medical intervention is important. If we feel we do not have control of our disease, medical intervention is important, because I love that my patients gain control of their disease. There is no cure yet. We're very hopeful for that one day, but there are so many treatment options, so we can give someone their quality of life back and control of their life. In terms of treatments, I always start with there's two types of treatments. There's the acute treatment and the preventive treatment. Acute treatment basically is what we utilize at the onset of attack to either completely stop or at least reduce the symptoms of headache as well as nausea, light sensitivity, sound sensitivity as quickly as possible so that we can return to our normal functioning. So everyone that has migraine disease, because I like to talk about it as a condition, not just headaches, but as a real neurological condition. Everyone that does live with migraine needs acute treatment. So it could be something as simple as an analgesic we find over the counter like ibuprofen, obviously knowing that it is a safe option for that patient, to a more specialized treatment option that is prescribed, such as triptans or Gepants. We can get into that if we have the time. So that is something we're going to utilize at the onset of attack so that we can really catch it and continue our day. But if a patient is already having a weekly attack, more than 4 per month, 5 or 6 just general, like headachy days, I would call it, doesn't even have to be the severe ones, or they don't have control of their attacks, they should also be on prevention. Prevention means I'm going to start you on a treatment that's going to reduce future attacks, reduce the severity and duration of those attacks as much as possible. That could be something from a daily medication, a monthly injection, or quarterly injections. There are many options. And just to mention them quickly, there are nonspecific migraine preventives. It means they are medications created for other medical conditions, such as blood pressure, depression, seizures, and they were found to help in migraine. And then there's the newer CGRP blocking medications, which are targeting directly this pain molecule involved in the migraine disease. So we can get into that, but there are so many options. But the gist of it is everyone needs acute treatment at the onset of the attack so that they're not disabled that day. Many patients need prevention to reduce future attacks so that they don't keep experiencing them continuously.
I'll tell you this, my wife's experience with Botox was incredibly positive. And when they first told her, and there are a whole bunch of things, you go through the list, it's like, as you point out in the notes, there's a lot of drugs, as you're saying, that people wouldn't expect. And this is why it is so important to actually, first of all, accept what you have is a recurring condition and not an isolated event. And second, once you make that decision, to then move forward with the recommendations that your doctor makes. You really have to stay in communication with your doctor on this. This is not something that you should tackle on your own, if in fact we're talking about the severest side of this condition, correct?
I agree. It's a chronic disease. So unfortunately, it is part of the patient lifelong. It can fluctuate throughout life, but I do think that, it is something to keep in check every certain amount of time, even if you're in a good place.
The other thing is, too, as you well know, our principal audience here is over-the-road truck drivers. We have a lot of people in transportation that listen as well. But, I will tell you, there have been times in my life at the peak of experiencing this, like I said, it was like a monthly occurrence for me. I'd get them driving on the interstate, and I'd have to pull over. I mean, there'd be moments where it's like, I mean, I'm like, I can't drive. I can't literally see my rear views. I want people to understand how serious this condition is, because it's an understanding that they're willing to like. The hardest thing often is accepting that you have a condition and not just a bad day. And I know I feel like I'm beating this home, but it's really important. How do we continue to break the stigma? I guess is what I'm getting at here. What can we do, those who don't suffer or those who suffer minimally, what can we do to make sure that more people understand this is serious business?
I think, campaigns such as the Shades for Migraine campaign are really important to raise public awareness about migraine as a serious neurological disease and show solidarity with people who do suffer from it. Something that, I know we're going to get into this, the Shades for Migraine campaign basically encourages everyone to wear shades, sunglasses specifically, on June 21st, which is the longest day of the year usually, to really show, solidarity with patients that live with migraine. And post it on social media, hashtag Shades for Migraine, tag others, explain it. I mean, just be very, open about this disease so that others can understand it. I think that helps spread awareness and educate. I think this is why, even this segment we're doing now is really important, because everyone that's hearing this, if they don't live with the disease, they probably know someone that does. And, it keeps spreading the word. So the more we spread the word, the more we are open about it, verbal, public about it, the better. We normalize it. We make it a common disease that is being, present, which is present between so many people, which is true. We all know someone that lives with migraine, even if it's not one of us.
By the way, guys, you can go to shadesformigraine.org is where you should head over to find out about that. By the way, our sponsor, one of our sponsors is absolutely delighted we're doing this segment. It's Shady Rays. We have a sunglasses sponsor, by the way, who's probably over the moon that we're having this conversation, which is a really groovy thing. And we got those wonderful promotional glasses as well too.
The purple one.
Why did y'all pick purple? I'm just curious.
That's the official color for the Migraine Awareness Month. June is Migraine Awareness Month, and purple is the formal color, so that's why the sunglasses are purple as well. And why sunglasses? How do we know someone has a migraine? It's really hard at times, but one of the most common symptoms is light sensitivity. And you may see someone using sunglasses indoors, or, your population, the truck drivers, the sun, the glare, and during a migraine attack, that can be very difficult for their daily job. And sunglasses really, protect them from getting worse. So if we see someone indoors with wearing sunglasses or something, then we should understand, okay, maybe they're having a migraine attack. That's a visible way of seeing it. So wearing them on that day just shows that we're supporting people that live with this.
I'll tell you something else too. One of the things I did discover, one of my trigger points, was late afternoon driving into the sun. Even with the even with the shade down, even with the the sun blocker down, I found that driving late in the afternoon into the sun for some reason became a trigger point for me. So I've made a real effort to kind of reduce that as well. I did ask you a question a little bit earlier, and I want to kind of go through it again, just because, like I said, my wife was really excited about this. CGRP inhibitors. Explain.
Yes. So there has been a great evolution in the treatment of migraine throughout the last few years, specifically since 2018 now. So it's been 7 great years, and definitely, hopefully, better years to come. So CGRP stands for calcitonin gene-related peptide. This is a molecule that's found in the brain and nervous system that plays a key role in causing the pain and inflammation associated with migraine attacks. So basically, someone who's predisposed, when they have a migraine attack, different regions of the brain are releasing CGRP, this pain molecule, we can call it, that really is making everything worse. So we want to block the activity of this molecule or the receptor where this molecule binds. And for many years, since the 90s, it has been identified this molecule to be a very important molecule to target But now we have a group of medications that have been FDA approved that target the activity of this pain molecule and reduce migraine attacks long term or treat them acutely. So one of the groups is called the monoclonal antibodies. They are monthly injections or quarterly injections that could be subcutaneous. There's one that's an IV infusion that will reduce migraine attacks long term. And then there are oral medications that are called gepants. They're small molecule CGRP blockers. Basically, you either take it at the onset of an attack or you can take it on a daily or every other day basis. So this is a group of medications that are specifically targeting, CGRP, which is really one of the main causes of migraine disease. So we have migraine-specific medications now. Botox, which, your wife is using, years ago, it was discovered in 2010 when patients would place it incidentally for cosmetic reasons, but they would be like, oh, wait, my migraines are better. So throughout the years, it was approved for migraine treatment and chronic migraine patients specifically. So your wife may be a chronic migraine patient if she's been on Botox, which means half of the time or more she's had headaches. And this, incidentally also blocks the release of CGRP. So it's a good accident that was discovered because now this is also a migraine-specific treatment. It's not like, oh, it relaxes muscles or it's a cosmetic medication. No, it's a real, true treatment for migraine as well. And I like to mention that because, we think of Botox and we think of cosmetic, but really has so many indications.
We are out of time. Remarkable. Terrific. I can't thank you enough, Dr. Fiorito. Absolutely great. One more time, tell people where they can go to get more information.
Yes, please go to shadesformigraine.org so you can read more about this global campaign. In addition, you can go to the American Migraine Disorders page and American Migraine Foundation. There you can find so much great information to really help learn about migraine and all the treatments.
Thank you for being the first guest on Highway to Health on Road Gang Radio. We've been doing this forever, for about 20 years, but in regards to this new platform, you are our first guest. Couldn't ask for a better one. Thank you, Doctor.